And a very good afternoon, everyone. Welcome to Issues and Attitudes on WEIU. My name is Jeff Owens, interim GM at WEIU. My student co-host, Annalicia Haynes.
Hi, everyone.
Who came in about 3 seconds ago. And our guest today, making her first appearance on Issues and Attitudes, is Dr. Mary Harvey from Sarah Bush. Thank you for coming in.
Thanks for having me here.
All right. So today we really want to talk a lot about vaccines and stuff like that. But since you're relatively new to Sarah Bush and the community, I'll let you just give a couple minutes to tell us a little bit about yourself, Dr. Harvey.
Well, I'm very Illinoisan. I was born in Peoria and raised there. Went to college in Peoria at Bradley University. And from there, I did my first year med school in Champaign at U of I and finished up the last 3 years at the U of I Medical School in Peoria. I did my first year residency then at Mayo Clinic, and then the last 2 years back in Peoria with the University of Illinois College of Medicine at Peoria in pediatrics. I practiced private pediatrics for a couple years, and I precepted, taught pediatric residents for about 10 years. Went back into private practice for a few more. I'm back into private practice here at Sarah Bush Lincoln.
There you go. Well, obviously in the news in the last really year, but it seems like even the last few months, the vaccines and the good, the bad, the ugly of them have kind of, reared their heads across the country. So I guess, talk about, as we get into specifics, if I can say that word or not, kids and vaccines, what are your opinions, and let's just go through some of the things that are being discussed out there.
Well, vaccines are truly one of the few modern miracles that we have. Vaccines and sanitation of water are probably the things that have kind of helped humanity survive as well in these last 50, 100 years.
There are people that don't think their kids should get vaccines for a myriad of reasons. When you talk to those folks, or you hear about those kind of folks, what do you try to tell them, or what would you tell them if you had a chance?
Getting vaccines are safe. Vaccines are safe. We wouldn't do this in the millions, billions if they weren't safe. And we do administer vaccines in the millions and billions, every year. The most unsafe thing about immunizations is not getting them. If we were to rewind, if we could go back a few generations ago and see what it was like when children did get hit with a lot of these diseases that we're able to protect against, it would be a completely different, I think, social approach to how we feel about them. We don't, in any of our lifetimes, remember seeing people with polio or, dying of measles, which is possible, and, just multiple diseases we're protecting against.
Now, it seems like there's always one case a year where somebody got a vaccine and something happened to that child. That's kind of what scares parents. Is that a true statement?
So these things aren't necessarily, they're not scientifically associated. There's anecdotal reports. And what that means is there's a timeline where it could be associated with it, but there's not a direct scientific reason for why something like that happened. Now, when vaccine-related injuries are reported, it's reported in a time frame. So, for example, say a child gets a HPV vaccine, goes for a bike ride and gets hit by a car a few hours later. That death was a few hours after the vaccine was given. It truly isn't related to the vaccine, but it occurred within a few hours. These are, associated deaths. It doesn't mean anything more than that, and the timeline was close. Now, sometimes some illnesses are reported as being timely to the immunization, but that in no way means that it was caused by it. I think that, the proof is, if you can just look at the numbers and look at millions versus few anecdotal cases versus, how serious it is to really be very sick or die from a disease if you were to get it. The chances, comparing those statistics really is just enormously overwhelming that it is safe to get immunizations.
See, and I'm really glad that you bring that up to the data that backs vaccines, because it seems like people who are against vaccines or immunizations, they go to random sources, like someone's blog, and that might be an extreme, but unfortunately it happens.
Right.
But there are medical journals that study different vaccines, and I mean, you can look at what happened during the flu epidemic in the 1900s or 1910. I guess it was a little over 100 years ago now.
Yeah. It was a horrible epidemic about 100 years ago that really took out a lot of
and
population.
That was the flu. And we don't even think about that now. But the reason why I bring that up is, where can people find these sources to obviously, other than going to your doctor and finding out yourself, where are some great links to see where people are publishing this stuff, whether it is in a journal or...
That's a great question. The CDC does provide a lot of lots of information on immunizations and the research behind it. As far as just everyday common information, there are wonderful resources out there like WebMD, MayoClinic.org. Even, hospitals will, incorporate. Sarah Bush Lincoln has a website with information. So I guess the important thing is when people are going to look for information, it's important to know that the information they're looking for is reliable.
Right.
Is it coming from a reliable source? What's backing the information? If these are just opinions that are backed by a few cases or individual stories, they're not going to stack up against the millions of of studies that have been done on that many cases.
Right, and it's just difficult. I mean, how do you even approach someone who is so stuck in this way of thinking, and say, here's what science says?
Yeah, and that's a couple of things I wanted to ask about, because, as I do the research for the pros and the cons and try to be as fair and impartial as possible here, what are some of the things that the people that don't want to get vaccines say? It's just their right not to get a vaccine. I mean, and you can't really argue that it's not their right, but by those children or those young adults not getting the vaccine, does that put anybody else in harm's way or not?
That's a great question. They are. I mean, actually, there is a concept called herd immunity, and that term has been out there.
If everybody else has it, I won't get it, right?
In a sense. So, I mean, there is actually a statistical number that people, surrounding in, say, a community, so many people have to be immunized against something to protect those few that aren't. And it actually is about 90%. So if, say, 10% of the population decides for whatever reasons not to immunize, there's a pretty good chance they won't get sick if 90% of everyone else is protecting them so that disease doesn't enter the community.
Okay, so then one of the other reasons for people not to get vaccines is that it thinks that the overall immune system gets weaker in a child if they have vaccines. Your opinion on that?
Well, I mean, these aren't opinions, these are facts. So
Good Dr. Harvey.
Actually,
I like that answer, by the
we
way.
get a lot of germs every day. So we breathe in everybody else's air. We all have different bacteria, virus that we carry around, and most of it's not harmful. In fact, lots of us have pets. A dog can lick you in the face. The number of germs that you get kind of transmitted to your mouth from your dog licking you is 1,000-fold the immune load that you get from an immunization. And I know some parents might worry about getting, say, 5 immunizations at the same time or more. The immune load of that is minuscule compared to, honestly, what we're exposed to every day. The tiny dose that's in an immunization goes to our immune system in a very clean, specific way to create multiples of that disease or virus or part of a virus to create memory in our body. Our body is creating the load in a good way. When you get a lot of antigens in, whether you fall off your bike and scrape your knee and get a whole bunch of dirt into your open wound, or however germs get in our body, that's nothing compared to the tiny amount that an immunization gives, because it's very specific.
Can you take us through, and I don't know how long this will take, but what is like the immunization process for from newborn to young adult, and when they, what all should someone have in your opinion?
So a lot of the immunizations are given within the first couple of years. The World Health Organization years ago set out to eradicate hepatitis B. So as a standard of care, we immunize babies against hepatitis B at birth. We start the immunization there just to get it started. The rates of hepatitis B worldwide have dropped significantly, especially in this country. We just don't see a lot anymore. But that's the first immunization typically given, is right there at birth. At 2 months, there are more introduced: diphtheria, pertussis, tetanus, polio, hepatitis B. Haemophilus influenza type B is a type of baby meningitis we protect against. Rotavirus is another one. And pneumococcus, which is a type of bacterial illness that causes some meningitis, some ear infections, some pneumonias, but the strains that are in the immunization focus on meningitis. So all those germs are what we're protecting against at age 2 months, 4 months, and then again at 6 months. That's kind of the early immunizations. If babies are on schedule, there's usually a pretty nice break between 6 months and a year. At a year, we start with, typically, that's when we start with protecting children against measles, mumps, rubella, and chickenpox. And then there's boosters required for some of the previous immunizations that we talked about. We also introduce protection against hepatitis A, typically at age 1, too.
Okay. That's interesting. Now, another thing I saw were people that are, anti-vaccines, or the anti-vaxxers, which I really don't like to say that word, but, when they say that some of these diseases are making a comeback anyway, so when you hear that, when measles have come back, mumps have made another appearance, what do you say to those folks who say they're coming back, or do they never leave?
So when a person gets an immunization, there truly is only about maybe, say, an 85 to 90% chance that immunization is going to actually work. Like, our body has to accept it, recognize it, and process it in order for our immune system to truly be immune against it. Sometimes it goes in, nothing happens. Literally nothing happens. For those, say, 10% of people where nothing happens, they have every intention of getting immunized, but they didn't. Another thing that can happen with some people is they get immunizations, and then after some time their immune system can forget about it. Now, this isn't common. This isn't typically what happens.
Yeah.
This is where we need herd immunity to help protect us. Where these, let's say, for example, now the big issues, measles, we've got well over 1,000 cases this year in the United States of measles, which is a vaccine preventable disease. The cases that are happening are in mostly unvaccinated children, and they spread to other unvaccinated children. But there are vaccinated children that can get it if they happen to be a child who's, for some reason we don't know, immunization didn't take. So,
I'm sorry, go ahead.
That's why we need the herd immunity, and we need the numbers up there to protect everybody. They're not just going to come back unless we're not immunizing properly.
There you go.
So when you look at the big picture, I guess you can see how this would affect herd immunity. I can't even say that
Herd
word.
immunity, yeah.
Two words you can't say today, Jeff. So because it's that 10% difference, I guess, because there's a 90% have to be vaccinated, right? About. So it already incorporates 10% of people that just unfortunately can't take, their immune systems can't take that vaccine. There's a bunch of other unaccounted people that are not just choosing not to take the vaccine.
Right.
So, I mean, that would damage that number, wouldn't it, that balance?
Bigger holes in our protection, and that's why these diseases are making a comeback. It's because of not vaccinating.
What about let's focus here a little, maybe Sarah Bush's area, Central Illinois. Have we seen cases of measles in this area lately?
We have. There were 4 cases in Illinois. Champaign area was hit with a couple. It hasn't come to the Mattoon, Charleston area, we know, but we're not too many counties over from Champaign, and that was fairly recently, just within the last few months. So yes.
Go ahead.
I'm sorry. So who's, like, obviously people who haven't been vaccinated, but they always say that the children and elderly are most susceptible. And I mean, I can assume that it's because of weaker immune systems, but is there something else that would make that the case?
So as we get older, there is kind of more of a risk that it's not that our immunization systems can't take the immunization. Sometimes, for whatever reason, they forget. So as we get older, whether it's from a vaccine or a prior illness or whatever the case, our immune systems do forget some of the exposures we've had, so we don't have the protection that we might have had in younger years. And for very young, it's one, because they may not be vaccinated against certain diseases, and 2, babies less than a couple months old, illnesses can spread real quickly. So when we don't know, what the illness is, we usually have to go pretty hard and fast figuring it out, so it requires a lot of medical involvement and workup.
Does family medical history play a factor too in immunizations, and whether family, or whether for lack of a better way, that the vaccine sticks? I mean,
well, there are situations, like, for example, chemotherapy or other immunocompromised situations where our immune system may not be up to par. Probably one of the most common things is having chemotherapy. It actually, part of what it does is destroy our immune system, so it can make us more susceptible to things that we weren't susceptible before. It can also make us susceptible to some of the live viruses that immunizations offer. So there is a special precaution to take when someone in the family is immunocompromised, whether it's because they're receiving a chemotherapy type of immunocompromising medication, or if they have some sort of innately born disease of their immune system. It's not real common, but it can happen.
The other question out there that a lot of people are asking is, let's just take Charleston or Mattoon High School. If there's 1,000 people in the school and 5 don't get vaccinated, I mean, should people be worried about that, or does that hurt community? Because I think that's the other question out there is, do people want to go to school with the unvaccinated, and vice versa? So, I mean,
surely as those numbers get bigger, the risk gets bigger. So, just as you were saying, we already have a built-in risk of some people, may not take to an immunization, or their immune system may forget it after some time, and they may need a booster and don't even know they need the booster. But then when you've got more and more people voluntarily refusing to be immunized, that's just making the risk bigger than it had been, and it's making it bigger unnecessarily. So it's something to think about. It's certainly something to keep in mind, although different immunizations protect against different diseases, and certainly different diseases are spread and do things in different ways. So,
and I know, reading about the flu shot, because the strain changes too. Does that affect immunizations as well?
Oh, definitely. So flu is, every immunization is different. Every disease is different. The flu is different in the sense that the flu influenza, which is the name of the virus, there's two major strains, A and B, but within those two designations, there's multiple strains, and they're constantly mutating. So scientists every year they work on predicting what the most prevalent strains likely to hit the United States are, and they do that by world surveillance. That's how they create the immunization, throughout the summer to be available in the fall to protect us for that coming winter flu season. Sometimes it's right on, they hit the nail on the head. Other times it's not so accurate. A couple years ago, I think, was sort of a year that wasn't quite as good. Yes, last year was a better one, but with the strains of that particular virus changing all the time, it's a moving target and it's hard to hit.
What do parents ask you the most? I mean, when they're talking about vaccines or health in general?
Well, vaccines, for babies, a lot of parents do want to know if the immunization schedule that we have, that's been determined scientifically, is necessary to do it in that order. Like, do we have to do these all at once? Can we spread them out? And honestly, there's no advantage to spreading out the immunizations. The intervals have been tested at those intervals, and the age that the immunization's been to be given is tested for those particular ages. So the standard schedule that's out there is truly the best way to do it. By spreading it out, it's compromising the immunization, and certainly compromising the protection to children.
Is there a way for a simpler solution in terms of, instead of, if you have to immunize for 5 or 6 different things, is that 5 or 6 different doses or shots, or can it be, I guess for lack of a better way, mixed together into one?
So a lot of the pharmaceutical companies are working hard to try to make combinations. We have combinations. All right. Certainly.
I really thought that was a dumb question, but I guess it is.
Oh gosh,
dumb.
no. In fact, whooping cough, which is pertussis, diphtheria, tetanus, and polio are often given, that protection's often given in a combination of those 4 things together. And a lot of times another thing's added in it, whether it be the hepatitis B booster or Haemophilus influenza type B booster. So a lot of times throughout those initial first-year immunizations, 5 of those different types of diseases are protected all at the same time. So 5 are combined into one syringe needle. It's very common. Certainly measles, mumps, and rubella has been combined as a single immunization for years now. We've not that recently, but within the last 5 to 10 years, been able to add chickenpox as a 4th. So those 4 things can be given in one syringe, one shot.
We have a few minutes left here. We're talking to Dr. Mary Harvey from Sarah Bush Lincoln Health Center about vaccinations. Anything that we didn't touch on that about vaccinations you'd like the public to know?
Yes, we actually didn't get anywhere near adolescent vaccines. We were kind of talking about...
I was just going to bring that, like HPV. HPV
we were talking a lot about infant and maybe preschool, and that covered the ones we talked about earlier. But then... boosters are required every 10 years for the tetanus, pertussis, and diphtheria. And meningitis gets to be a very important thing. Years ago, a lot of colleges were absolutely requiring that the protection against. So after almost all colleges in the United States started requiring the meningitis shot, the disease started going down to high school. After high school started implementing it at 9th grade. We started to see it in middle school. So now that immunization is required by the state for good reason at 6th grade, and then a booster because it only hangs around for about 7 years. Not all immunizations last forever. As you know, why we have to get the tetanus shot every 10 years. So that's an adolescent one. HPV is very important. Mm-hmm. We know that human papillomavirus is the cause of cervical cancer most of the time. Why wouldn't you prevent that if you could? The risk in giving the immunization is nothing, really. It's just soreness at the site Very rare anaphylaxis, but if you could protect your kid from cervical cancer, anal cancer, penile cancer, throat cancer, these are cancers that this virus causes, and we can prevent that.
Okay.
I just remember when
That's a good question.
they introduced, well, it probably was introduced before that, but I had to take it in high school, and my mom was like, "You're getting it. I don't care what you say." And I was like, "Oh, okay. You're still in charge of me. I don't have much of a say." So I thought it was very, very important. So
Yes.
I don't know if you can have a favorite shot, but that would be my favorite immunization,
Well,
just because I think it's so
been
important.
Another, like, probably one of the more recent miracles we can see that, you know, have definitely seen a decrease in cervical cancer in women who have received this immunization.
There you go.
The proof is right there.
Couple minutes left here. Let's switch topics and let's have some fun. So we've kind of been on the serious mode today. We'll let Dr. Harvey have some fun questions. So you said you went to Bradley and your degree, and you so we know that. So give us one information. Give us a little tidbit from Bradley University that we don't know about.
There's no football team. So don't let anybody try to sell you a football
Tickets
season.
there. All right. Favorite all-time TV health show?
Is this fictional?
It can be
or
fictional or real. Either.
Oh, I loved ER.
Okay.
And actually, when I was in high school, St. Elsewhere.
There you go.
I don't know. You probably don't remember that one.
I know ER just because of the popularity, but I don't know that
Yeah.
Favorite TV doctor?
TV doctor. Oh my gosh, who doesn't like George Clooney? But that I'm dating myself.
Well,
that
I
was
wasn't
a
going to say
long time.
that. Don't look at me. I never ask. That's all right. George Clooney's a good one, popular. All right, ice cream flavor. What's your favorite ice cream flavor?
Anything with a chocolate base, pretty much.
At least you want to get it on that one.
Oh, I had lemon ice cream for the first time.
It's
That's
the
a
best.
good
Yeah,
one.
yeah.
Oh yeah.
People don't understand that lemon ice cream
I'm
is the
so
best
glad you
flavor.
brought that up because I've been wanting to tell you.
Your first pet and what was its name?
My first pet was a cat, and I was only one, so it was really not my choice. My parents, Siamese cat, so they named him Sin, which I guess is a Siamese name.
Sounds about right.
Hey, let's see. First pet.
A bird named Ricky.
There you go. Toughest class
Yeah.
in college.
Physical chemistry.
Did you take physical chemistry or DIU?
No. I would refuse, but you are on the doctor track, so that wouldn't make sense why you had to take that. I think it's going to have to be my math class that I'm going to end up taking because everything is just fleeting. So.
All right, last question for Dr. Mary Harvey. The oddest food that you've ever tried?
Probably whole octopus babies. They were just pickled octopus, and they were small, like really tiny whole octopus.
Yeah, that beats mine.
That wins. The
Yeah.
best answer ever for that
Really?
question. Yeah, I've never heard that one. That's a good one.
Yeah,
So,
my kids
we're out of
bought
time,
some,
so-
and I had to
Yeah.
eat it
There you go.
because he made me.
Well, Doctor, we do appreciate you coming in. It's been enlightening. We've learned stuff. Thank you very much.
Thanks for having me.
All right, we are WEIU.